Okay, good afternoon, everybody. We're going to go ahead and get started. Thank you for joining us. My name is Nora Landis-Shack, and I'm the Manager of External Relations at the Fund for Public Health in New York City. I'm excited to welcome you all today to the sixth installment in our Public Health Talk series on the coronavirus in New York City. Today, we'll be speaking with Myla Harrison, the Assistant Commissioner for the Bureau of Mental Health at the New York City Health Department, about the mental health impacts of COVID-19. A few technical notes. You can write any questions you might have using the chat feature or the question feature, and we'll do our best to respond either in the chat or afterwards via email. We will also send out a survey to receive additional questions and feedback after this, and would really appreciate if you can let us know what you think. The talk will last about 25 minutes. We're recording, and a copy of this will be sent to you afterwards as well. If you experience any technical difficulties during the call, please let us know by emailing info@fphnyc.org. I'm now going to pass it over to Sarah Gardner, our Executive Director.
Great. Hi, everyone. Thanks for joining and welcome to Public Health Talks with the Fund for Public Health in New York City. As Nora said, my name's Sarah Gardner. I've been the Executive Director of the Fund for the past 12 years. I know we have a lot of repeat listeners, so thanks again to you for joining. But for any new guests today, just a few things about the fund. We're an independent nonprofit that we work closely in partnership with the New York City Department of Health and Mental Hygiene to improve the health and wellness of millions of New Yorkers. We do this essentially by creating partnerships and securing funds to test out new ideas and launch innovative public health initiatives to keep all New Yorkers healthy. Particularly during this epidemic, we've been working closely with our partners at the health department to secure resources and identify opportunities to help more New Yorkers in need at this time. And as a nonprofit partner to the City Health Department, we feel very strongly it's our responsibility to share information, accurate information about public health and highlight public health initiatives that are going on in the city. We design these talks with that in mind so that you, our listeners, can learn more about the health department, what they're doing, often behind the scenes with little fanfare on behalf of millions of New Yorkers. Today, we're lucky to be joined by Dr. Myla Harrison. Myla is the Assistant Commissioner for the Bureau of Mental Health at the New York City Department of Health and Mental Hygiene. She's here today to talk to us about the Health Department's Mental Health Emergency Response Group and the mental health impacts of the COVID-19 emergency. So Myla, thanks so much for joining us. I know you have a very busy schedule, but let's go ahead and get started. Why don't you start by telling us a little bit about the Health Department's Mental Health Emergency Resource Group, what they do, and how it's related to the COVID-19 emergency response.
Great. Thank you so much, Sarah and team. I just want to also say thank you for inviting me to talk about this really important topic with the group, because there is a lot going on related to mental health, related to this pandemic. The Mental Health Emergency Response Group is a part of our, what we call the incident command structure within the health department that's responding to the COVID pandemic. What we are charged with is a number of things. We are looking at mental health and substance use disorder from a surveillance perspective. We are looking at emergency room visits for behavioral health issues to see if there's any changes. We are also supporting our behavioral health providers so that if they have issues or concerns, we're able to meet their needs. We also support the public. There's a lot of guidance and other documents that we've put out on our website. I can talk more about that in the course of this about half hour. And we also support our own health department staff who are activated as part of this emergency response. So a lot of activities that are going on from a mental health emergency response perspective.
Thanks, Myla. So it's a lot going on, and it's not just about the pandemic, but it's also core services and business as usual. So I know you have your hands full. And we are reading so much in the news today, and I think most of us are feeling at home as we're sheltering in place, that the effect of COVID-19 and how it's impacting the mental health of so many New Yorkers. Can you speak to that about, what are the impacts on mental health, and in particular, the effects of pandemics such as COVID-19 on the mental health of individuals and populations?
Yeah, absolutely. I appreciate the question. So COVID-19, the pandemic, impacts us on so many levels. And on one hand, we're all in this together. This impacts our communities, our friends and our family, our coworkers, and ourselves from, whether it's potential losses that we've been dealing with, freedoms that we've lost to travel around, actual losses of loved ones, and changes to our routines, to name a few. But we also know that even though we're all in this together, it doesn't impact us all equally. So there are disproportionate impacts for different communities. We've been learning more about that. We also know, as you all know, that this is a worldwide shared traumatic experience. It disrupts and affects our families and friends. It also compounds any stressors that we experience. That includes food, housing, employment, those sorts of issues. And it really does highlight structural racism as a leading factor contributing to disproportionate hospitalization and death rates. And we've been hearing more about that from the health department and others. Trauma is a single stressful life event, but it's also a series of events. And if somebody has been traumatized already, a trauma like a pandemic may make things worse for them and contributes to the people of color, communities of color more so. There are psychological and behavioral responses to pandemics that we know about from prior incidents and prior, not necessarily pandemics, but prior disasters such as this. We know that the psychological footprint of COVID is going to be significant and anticipated to be larger than the physical health imprint of COVID, particularly over time. And we can expect a significant tail of mental health needs that will extend for time after this event. The kinds of things that we know we'll see, that we've already been seeing, include things like distress reactions. So this is sleep difficulties, decreased sense of safety, some physical symptoms related to stress, irritability, anger, but we could also see health risk behaviors. And that could be increased use of alcohol or tobacco or prescription drugs, family distress, interpersonal conflict, domestic violence, disrupted work-life balances. So those are health risk behaviors that add burdens as well, particularly if there's increased alcohol use and adverse effects on families and conflict related to that. We know that these sorts of health risk behaviors show up in primary care and law enforcement, not only as mental health issues. And so the other kinds of things that we know we might see are more intense psychiatric disorders, such as depression, post-traumatic stress disorder, anxiety, complex grief. However, I have to say this, most people will be resilient. Most people will not have lasting issues. And so we need to do more to help promote resilience. So some of the unique public health responses to pandemics include what I've been talking about: fear and uncertainty, the potential for isolation and quarantine, what we've been dealing with, shortages and scarcity of PPEs, for instance, misinformation. All of these kinds of things can lead to anger and stigma and scapegoating. And it's perception of people that determines if they will follow some of the guidance that we've already have out there. And again, this sort of response to a pandemic can lead to a decreased access to care or heightened stress, which most people see, losses and trauma, which fewer people will see, but certainly will be there, and uncertainty and loneliness, which many people will experience. We also can anticipate other sort of behavioral health implications, and I'm reading my notes over here, so that's why I'm not always looking at you, sorry. Sarah, if it's distracting for the audience. So some of the anticipated behavioral health implications are that, again, based on past disasters, is again, persistence over time, and that the need will likely be greatest in areas that are most impacted. And again, communities of most impact and people who have histories of behavioral health challenges. Again, those are going to be our more significant impacted areas. We know already that the mental health impacts of COVID-19 pandemic in New York City are leading to increased sense of anxiety, particularly around the COVID-19 illness itself. We've seen that in some health opinion polls that we've done at the health department. We also know we are likely to see increased depression. So we've also surveyed people, and close to half the people in the survey say that they have symptoms of depression. We know that that's more than what we see in our community health surveys, which are closer to about 1 out of 10 people with symptoms of depression. We also know people have increasing financial insecurity, and they've told us in these polls that that financial insecurity is contributing to them feeling more stress and not coping as well. And we also know that people are reaching out to help. So we have our NYC Well call, text, and chat line, and we have seen increased volume and that service since the beginning of the pandemic. And I think, again, we can anticipate a lot of stress related to that as well.
Well, thank you for that, and it's reassuring to know that what we're all experiencing is normal and actually anticipated during times of pandemic when there's tremendous stress and our world has essentially been turned upside down. So, what can an average? We've learned so much about the physical impacts of this and how to protect ourselves. How can the average New Yorker deal with all this and ensure that they're resilient and that this is temporary?
Yeah, and that's a great question. So as I did say, stress is anticipated here. Stress is normal, and some of the typical stress reactions may happen immediately or may happen weeks or months later. The kinds of things that we want people to know is stress alone doesn't mean that you have a mental illness. And stress can temporarily affect your physical health. And yet, as I've been saying, most people are resilient and can cope with support from others and loved ones in these families. So the kinds of stress reactions that we know we'll see can look physical. That can be exhaustion, headaches, rapid heartbeats, worsening of existing medical problems, as I've said. Feelings of sadness or anxiety or anger or agitation are common stress reactions. Having thoughts of being confused or forgetful or difficulty concentrating are also common reactions people have to stress, as well as restlessness and argumentative. But not everyone will react to stress in the same way. Again, these are normal and typical reactions, and it's important that people know that they are not alone if they are feeling that. Those are common. We also know that COVID has turned our lives upside down, and we are working in ways we've never had to work before. It's unprecedented in so many ways, and it also impacts our basic needs, employment and access to food for many people, ability to pay rent. And so it's really critical for people to know that meeting basic needs has to come before addressing psychological well-being. So if there's somebody who doesn't know how they're going to pay their rent or how they're going to get food on the table, it's more important that we get them that need and then deal with psychological well-being. And so the city has lots of resources for that as well. On a mental health perspective, we have NYC Well that I've mentioned as well. But again, people are dealing with so many losses that we have to be aware of the loss and the impact of the loss. In terms of coping with stress, though, so for folks who are ready to cope with stress, once we've met address basic needs, it's important to stay informed and to make sure that people are informed with real information and real news and not misinformation. But it's also important not to stay glued to the TV and the computer screen and media all the time. It's important to take breaks from that because that can be stressful in and of itself. And so we need to let people know it's okay to tune off the media. It's really critical to stay in touch with loved ones and to maintain and or create daily routines, even though routines have been turned upside down. It's important to stay focused on positivity and the kinds of things that are strengths for people, and that's going to be very individualized, but to focus on things that they do have control over as well. Be proactive. Those are important ways to cope with stress. It's important to be thoughtful and sensitive to others in the community. There's been a lot of attention paid to people who are unfortunately having bias crimes against them. It's important for us to not condone that and to really be sensitive to people who are having different kinds of impacts from this pandemic. And again, really critical to stay connected and to seek resources if needed through NYC Well is one example.
Great. Thanks, Myla. That's really helpful, and so much of what you're saying resonates with me. But so what can you tell us? You already mentioned NYC Well as a resource, and we know New York City has devoted a lot of time and attention to putting a spotlight on mental illness and mental health. But what are some other resources that are available to people? And as we move forward towards the recovery phase of this, what can we expect from the health department? You say that the impact of the mental health will last longer than the impact of the physical impact of the epidemic. So what are we looking towards over the next few months?
Yeah, it's a great question. Thank you for asking it. So in terms of support, NYC Well is one of our most critical city resources that we guide people to. Again, NYC Well is staffed 24/7 with counselors and peers and is available for people on the phone, with a telephone call, with texting, or with chatting online. And they can provide brief counseling, and referrals can be made. They can take calls in over 200 languages as well. And again, that number is 888-NYC-WELL. And if people want to text, you text WELL to 65173. And chatting's available online on their website, nyc.gov/NYCWell. The other really nice part about NYC Well is that we have apps that are available for people to use for free. And those apps can also be accessed at that same website, NYC Well. And the apps, there have been additional apps that have been added for COVID specific reasons. So those apps have, it can help you with mindfulness. They can help you assess symptoms for depression or anxiety. There's a lot of them available. Some are available for youth as well. And again, a resource that, you know, it doesn't mean you have to go see someone or speak to anybody, but that at least are available for people if they want to check them out. There's also a New York State helpline. It's called the New York State COVID-19 Emotional Support Line. That phone number is 844-863-9314. They are not 24/7. They are 8 a.m. to 10 p.m., 7 days a week. They've got volunteer professionals, mental health professionals answering that line, just as another resource. The volume for NYC Well has been very high, and so people do try to call and feel frustrated. There's more than one resource out there for folks. So I want people to know about that. I think it's a critical resource. The other information we have is on the health department's COVID-19 web pages. We have a whole page just for coping and emotional well-being with a lot of resources on coping, tips for coping with stress, for loss in general, for grief specifically. We know there are a lot of people out there grieving, so we have tip sheets for people who are grieving, who want to access that. We have tip sheets for distinguishing panic attacks from symptoms of COVID. A lot of information there, translated into multiple languages, information there for the public to use and access. You can download a lot of our resources. So I want people to be aware of that. There's information there for parents of kids as well, for healthcare workers, for other folks as well. So really a lot there that we want people to be able to go to and use. And from, you asked about kind of where we're heading and kind of what to anticipate for the future. And so we continue to monitor the indicators that I was briefly mentioning earlier, indicators that tell us access to behavioral health care, access to emergency rooms, so that we can stay aware of the behavioral health impact of COVID-19 on the needs of New Yorkers. And we know we've got to continue to build capacity to provide enhanced support and screening and detection for behavioral health challenges, both now and into the future. There's a lot of work at the health department and with our colleagues at health and hospitals on working toward testing and contact tracing and quarantine and isolation. And we know that's all going to impact anybody, all of us in the future, and will impact people that have behavioral health needs as well. So we're putting a lot of attention into that. We've applied for some federal grants with our colleagues at the State Office of Mental Health. So crisis counseling programs and support are going to be available to New Yorkers, New York City, as well as New York State, since some of the grants have been funded to date and others we are still waiting on, but there will be crisis counseling resources in the future as well. At this point, mainly through our phone lines and talking virtually with people, but certainly things that we are closely planning as we move forward.
Great, Myla, thanks so much. Really appreciate you taking the time to come speak to us today. For the listeners, this is all the time we have today. Part of the design of these are short, so we're able to pull in people like Myla who have been activated and working 24/7. Just give us a little bit of time to talk about some of the work they're doing. So thank you to everybody for joining today. We're hoping to do these presentations as often as we can. And again, we're very grateful to the health department for taking the time to do them. You'll shortly receive an email after this call with a link to the recording and a survey. So please share any additional questions you may have. We also want your feedback so we can improve for next time. So please share your thoughts. We can definitely share some of the links that Myla mentioned during her talk. So as we move into the city's recovery phase, we're definitely exploring ways that we can work with the health department, with Myla's team in particular, to raise funds for special mental health pilots for New Yorkers across the city. We are still raising money through our epidemics fund to support projects. So thanks to those of you who have already donated. But if those of you who would like to, you can find the link on the screen. And please be sure to follow us on Twitter, Facebook, and LinkedIn to stay updated and learn about upcoming talks. Again, thank you for joining, and until next time, stay healthy.
Thank you.
Thank you. Have a good afternoon.